Have you heard of Wolff-Parkinson-White Syndrome, but still have questions about it? Don't worry, in this video we will answer the 8 most frequently asked questions about WPW and leave you well informed about this cardiac condition. Stay tuned. What is Wolff-Parkinson-White Syndrome? Wolff-Parkinson-White is a cardiac condition that occurs when there is an additional electrical pathway in the heart that can cause accelerated heartbeats, called tachycardia. This extra pathway can interfere with the normal heart rhythm, leading to episodes of dizziness, palpitations, or even fainting. Tachycardia can occur suddenly, lasting seconds, minutes, or even hours, and can be frightening and debilitating. How do normal heartbeats happen? Normal heartbeats occur through a coordinated electrical and mechanical process in the heart. The heart is made up of 4 chambers, 2 atria, and 2 ventricles. The beats start when an electrical signal is generated in the sinoatrial node, located in the right atrium. The electrical signal travels through the cells of the heart muscle, causing the heart to contract and push blood through the body. Normally, the heart beats regularly and at a frequency of 60 to 80 times per minute. However, in some situations, heartbeats can become abnormal. This can happen if the electrical signal is not generated correctly or follows the wrong pathway through the heart. These abnormal heartbeats can cause symptoms such as palpitations, dizziness, and fainting, and can be a sign of more serious heart problems. Why is heart rate abnormal in WPW syndrome? WPW syndrome is a heart condition in which the heart's electrical signal uses an abnormal shortcut to spread throughout the heart. This shortcut can cause abnormal heartbeats, usually fast ones, leading to symptoms such as dizziness, fainting, and even cardiac arrest in severe cases. It is important to note that not all people who have the abnormal shortcut present symptoms of WPW syndrome. Some people may have only a WPW pattern, which means the shortcut is present but not causing abnormal heartbeats. In these cases, these individuals usually do not require treatment, but it is important to have regular medical follow-up to monitor the condition. However, in cases of WPW syndrome with abnormal heartbeats, medical treatment is necessary to control symptoms and prevent complications. Treatment may include the use of medications to regulate the heart rhythm or catheter ablation, a procedure in which the heart tissue responsible for the abnormal shortcut is destroyed with a catheter to prevent the spread of the abnormal electrical signal. Proper treatment can help control the condition and reduce the risk of serious complications. What are the symptoms of WPW syndrome? WPW syndrome can cause symptoms such as palpitations, dizziness, and fainting. This is because the syndrome allows the heart's electrical signal to use an abnormal shortcut, causing the heart to beat faster than normal. Although most people with WPW syndrome do not have other heart problems, some people with WPW syndrome and other heart problems may experience more severe symptoms such as chest pain and difficulty breathing. In rare cases, WPW syndrome can lead to sudden death. It is important for people with WPW syndrome to monitor their symptoms and receive proper treatment. Treatment for WPW syndrome may include medications and procedures such as catheter ablation. It is essential for people with WPW syndrome to follow their doctor's recommendations to ensure a healthy and complication-free life for their heart health. Is there a test for WPW syndrome? Yes, there is a test to diagnose WPW syndrome, which is the electrocardiogram. The ECG measures the heart's electrical activity and can show if there is an abnormal rhythm or rate. In the case of WPW syndrome, the ECG can show the presence of a delta wave, which is a characteristic sign of the disease. In some cases, other procedures may be necessary to confirm the diagnosis or evaluate the need for treatment. For example, a Holter test may be used to monitor the heart's electrical activity for an extended period, usually 24 hours. Additionally, an electrophysiological study may be performed to map the heart's electrical activity and identify the exact location of the extra pathway. How is WPW syndrome treated? The treatment of WPW syndrome depends on the severity of symptoms, the frequency and duration of tachycardia episodes, as well as other cardiac conditions that may be present. In many cases, patients do not need treatment, especially if they are asymptomatic. For those with symptoms, treatment may include antiarrhythmic medications and medications that slow down the heart rate. Another treatment option is catheter ablation, a minimally invasive procedure in which a catheter is inserted into a vein and guided to the heart. The catheter is used to destroy the part of the heart tissue that is causing the abnormal heartbeats. This procedure is generally successful and has low rates of complications. In rare cases, when WPW syndrome is associated with other serious cardiac conditions, cardiac surgery may be necessary. It is important to note that WPW syndrome is a treatable condition and can even be cured through ablation. What treatments can stop a tachycardia episode? There are several treatment options available to control episodes of tachycardia in people with WPW syndrome. Some of the options include vagal maneuvers. Some maneuvers that people can do, such as coughing repeatedly, ingesting cold water, and performing the Valsalva maneuver, stimulate the vagus nerve, which can lead to the reversal of the tachycardia crisis. Medications. There are several medications that can help control episodes of tachycardia in people with WPW syndrome. These medications can be administered orally or via injection, depending on the severity of the episode. Cardioversion. During cardioversion, the doctor gives an electric shock to the heart to stop the fast heartbeat. This allows the heart to return to beating normally. Catheter ablation. Ablation is a minimally invasive procedure that uses catheters to destroy the heart tissue that is causing the extra pathway in the heart. This procedure can be performed in more severe cases of WPW syndrome or in people who do not respond to other treatments. The chosen treatment will depend on the severity and frequency of the tachycardia episodes, as well as other medical factors and personal preferences. It is important to consult a specialist cardiologist to determine the best treatment for each individual case. What treatments can prevent future episodes of tachycardia? There are treatments that can prevent future episodes of tachycardia in patients with WPW syndrome. One of these treatments is called radiofrequency ablation, which is a minimally invasive procedure performed by a specialized cardiologist. During radiofrequency ablation, a probe is inserted through a catheter and guided to the heart. The goal is to destroy the heart tissue responsible for the shortcut that causes tachycardia episodes. This procedure can be curative, meaning it can completely eliminate WPW syndrome. In addition to radiofrequency ablation, there are medications that can be used to control tachycardia episodes in patients with WPW syndrome. However, these medications do not cure the disease and are not recommended for preventing future tachycardia episodes. They are an alternative for patients who do not wish to undergo the ablation procedure or for those who are not candidates for radiofrequency ablation. If you are experiencing WPW symptoms, radiofrequency ablation may be an effective and safe solution for you. Don't hesitate to consult a doctor for more information. Thank you for watching this video about WPW. We hope you found it informative and enjoyable. If you'd like to see more content like this, please consider subscribing to our channel. By subscribing, you'll be notified whenever we release a new video. So click the subscribe button and join our community. Thanks again for watching.